Our team at Serif Health has been working with all of this newly published price transparency data for the last several years and has the potential to be really transformative by bringing in reimbursement insights and data that has only been in a black box before for anyone in the healthcare ecosystem, especially healthcare providers who often had no idea what their reimbursements were versus any other providers, whether it's in their market or across the country. And this really spills over to the larger healthcare problems that we have today for the patient, which is never really understanding what's the cost of healthcare. And so we at Serif Health have been really excited to be on this journey of working with the transparency data and starting with something that's really complex, making it usable and easier to understand and providing insights for customers across the healthcare ecosystem. And we're really excited to get this conversation started today because we have been working with a lot of really new innovative providers that excel in things like the care that they give to patients, but now can really add this level of data and insight to understanding their operations, their financials, and how to understand the broader market as they build out their strategies and expand their operations to ultimately give better care to more people and more patients in a more easy to understand way. So really excited to chat and get some of our insights from one of our early partners here, Prosperity Health.
Yeah, thanks, Rafiq. I'm excited to dig in on this with you.
All right. Well, for our formal intro to kick off, welcome. I'm Rafiq Ahmed, the CEO of Serif Health. And today I'm sitting down with Brett Reed, the SVP of Product and Operations at Prosperity Health. So we're here to talk about something that's been on a lot of people's minds in healthcare, both good and bad. How do we actually make sense of price transparency data? And more importantly, how do we use it to deliver better care? So Brett and the team at Prosperity recently started working with us, and I thought this would be a great opportunity to have an honest conversation about what drove the decision, what are the challenges in behavioral health specifically, because this is an area that us at Serif Health are really invested in and really excited about working on, and kind of share a little bit with the audience about where we're headed together. So Brett, thank you very much for joining me.
Yeah, thanks, Rafiq. I'm really excited to dig into this with you.
Awesome. And so to kick things off, let's give people a little bit of an introduction around Prosperity Health and what do you do? So just to start, what does Prosperity Health do and who are you serving?
Sure. Yeah. Well, Prosperity Behavioral Health is a full suite revenue cycle management firm, technology and services, serving the behavioral health space with a specific focus on the substance use disorder and addiction treatment space. And we were founded in 2017. It's actually a really interesting story. Our co founders were investment bankers, and they were working for a group that was actively in the market looking to acquire treatment facilities. And when they were doing their diligence into the health of the financials for these treatment facilities, they would look at these books and realize that it wasn't really a healthy book or that the numbers were a little opaque. And so, as they were evaluating the market and seeing this time and again, they realized there's an opportunity to serve this market and help them get paid efficiently. So they came out and started a revenue cycle management company, uh, human services only. We've subsequently evolved into a tech-enabled service business along with standalone technology, and we serve the full continuum. And we're now backed by a private equity firm, New Spring Capital. Um, we're the leader, one of the leaders in the space in rev cycle for behavioral health.
Yeah, very interesting. That's actually funny enough, a very similar story how Serif Health got started, because I was a healthcare consultant looking in at all of these different deals or valuations around healthcare organizations, whether it was, every specialty under the sun. And always the big gap was around reimbursement data and what that was. And it ended up kind of taking us on a path to, what is that data? Why is it not public? And when the transparency regulations started to come out, kind of it linked kind of exactly the problem kind of I had encountered time and time again as a consultant on that front. So very, very interesting. And so let's jump a little bit into kind of your role at Prosperity. So kind of as the SVP of product and operations, kind of what's your day-to-day role and kind of what gets you excited about behavioral health and specifically kind of the substance abuse space that Prosperity's in?
Yeah, no, thanks. So, my role is like anything, it's evolving in real time as well. So when I first joined Prosperity about 2 years ago, and my background is an entrepreneur, co-founder of a technology company in healthcare, went to behavioral health and outcomes monitoring and software technology, and found my way to Prosperity because I was excited about the opportunity to serve the addiction treatment and substance use disorder space because it's been kind of an underserved space historically. And what my role is both to help ensure our customers get paid in a timely fashion, right? So helping claims get on file with insurance providers, making sure they get paid, and doing that in the most efficient way possible. And we do that a lot with tech enabled human services. But where my role is evolving into, and where I'm really excited to spend time, and why this partnership is so important to us, is becoming more of a thought partner for our customers. So, getting claims paid, that's just table stakes in what we do. And we should be able to do that really consistently well for our customers. But helping our customers see where the puck is moving, and, skate to where the puck is going instead of, being where they're at today is really important to our customer base. So part of my job is ensuring we help them understand where the payers are looking to go in the future. And a lot of that's tied to, you know, if you were to look at Prosperity in 2019, most of our customers were out of network providers. They didn't
Hmm.
even think about being in network with payers as a strategy. Out of network was where the space was, and payers weren't really paying a lot of attention to our customer base. And we've subsequently moved more into an in-network posture, and our job is to help our customers get ready for that. And when I joined, we had outsourced all of our contracting work to third parties. So we had no insight into our customers' contracting process, their reimbursement rates, anything of that nature. And we had completely turned it into a transactional service provided by a service provider. And what we've done, and since I've joined, is turn this into a strategic subscription model with our customers.
Interesting.
So they are now working with us on payer relations as a service because we firmly believe this is not a one-time event. You go in every 3 years and negotiate a new contract. This is an opportunity to really have a relationship with the payers.
Hmm.
And part of that work that we do is to make sure we understand that they're getting paid appropriately relative to their peers and the services that they're provided. So that's a big component of how we're looking to evolve our solution over time, and where I'm focused my attention in the next 12 to 24 months as well.
No, that sounds super interesting. And so, in terms of that, like, especially, it sounds like there was definitely a challenge of kind of evolving the product from working with out of network providers to increasingly in network providers. Kind of, is that one of the biggest challenges you're seeing kind of for Prosperity right now? What are some of the other kind of challenges you're seeing the space that you want to tackle kind of as you become more of this like relationship driven kind of organization or service for the providers that you work with?
Yeah, it's definitely one of the biggest challenges, and I look at this from kind of two macro views. One is that, right? The payers are starting to look at their networks and saying, how do we best serve our members, and by extension the employer partners that we have.
Yep.
And the best way we can do that is to make sure we have a really strong network of service providers in the SUD and addiction treatment space. So they are looking to move folks in network. And so one of the things we're advising our customers is don't be late to the game. You
Hmm.
don't want to be squeezed out as a provider, especially for these folks that you have a large presence in your geographic region. I think that's one really strong macro thing that we're focused on. The other one is similar in the behavioral health space. So, when COVID hit, access was the big problem.
Hmm.
Everyone wanted to make sure that there was access to treatment and it was covered by insurance. And in my previous role, I was working with a lot of outpatient service providers, and that's all I heard from the payers. Look, we need to make sure that people can see a behavioral health professional when they need one. And that's shifting. I think a lot of the payers have said, hey, we feel really good about access now. And certainly there's always ways to improve, but now we're focused on quality.
Yeah.
And so, how do we make sure that our in-network providers are the best ones possible for our patient population? So they're hand in hand, right? It's being in network, but it's also being able to help the payers understand who our customers are, what kind of treatment they provide, and what the quality of that treatment looks like. And that's where we're really focused on
Yeah.
with our customers, and where I see, the future going in behavioral health.
No, that makes sense. And I think that's a great time to kind of go into the sort of question around the partnership and why we started working together here. Because kind of as you're making that transition of, okay, we're focused on kind of improved access onboarding more providers, kind of, being able to focus on that to now showing quality and being able to kind of really help the providers you work with on that front. Kind of what were some of for in terms of thinking about price transparency and our partnership together around that data, kind of, what was the catalyst for you seeking out price transparency tools? What problems were you trying to solve?
Yeah, it's a great question. And I think that macro focus was the first, which is okay, if we're seeing the market move to an in network posture, how do we be out in front of this and how do we best support our customers? Well, first and foremost, let's not outsource that work to a third party, right? We need to own that. So, how do we own that? Well, let's differentiate ourselves in the market because there's a lot of folks out there saying they do contracting as a service, but they were treating it transactional.
Hmm.
Okay, we'll author this contract and don't talk to me again till 3 years go by and you need me to renegotiate it. And they were renegotiating blindly, right? Based on, okay, last 3 years ago, I was at $100 per unit. Now I want to be at 110 because it's been 3 years and I should have a 10% increase. We saw this as an opportunity to flip the script and become a partner and do it through a subscription service. But if we were going to serve our customers well, we needed to know what we were negotiating against in terms of where they were stood, not only within their own, contracts, but also to their peers and the national averages, and we didn't know how to do that. We have a pretty large customer base and we have a great data set within that, but we're using our own data. And for all we knew, we were completely underwater with our rates relative to our own customer base. So we needed to find a solution to expand that and give us access to data so that we were coming armed into our conversations with our customers and with our payers to help inform the conversation. And the other component that I'll say is we really view this as a really a two-sided conversation. The
Hmm.
last thing we wanted to do was go to the payers and upset them because we're telling them you need to increase rates by 30-40%, and we understand that the payers also have P&Ls and budgets and stakeholders that they have to report to. And if they authorize a bad contract relative to rates 3 years ago, we're not going to make that up in one conversation. So it's also about educating our customers on that component as well, that this is a journey and not a moment in time where you're going to suddenly see a 50% increase. We have to get there together. And we also have to leverage the quality data and the program results that you're generating to inform that conversation as well. So it's a really holistic view, and the transparency data is so critical to that.
Yeah, no, I think that's like something that we've been trying to impress on kind of the market in general, but a lot of our partners that we work with is that, contracting may have been something that was just a moment in time in the past, which was, at most an annual exercise, but many of our customers that we work with and partners would say that, contracts are only negotiated every 3 years, or in some cases, out 10 plus years. And of course, if you only talk to, the payers, every 3 years, it's never a fun conversation. It's always a contentious negotiation. So being able to kind of build that partnership and bring this data into the fold, I think has been a really, I would say, unexpected but positive outcome of being able to be more data driven like this with the transparency data, which is that data strategy becomes more of that two-way street, as you're saying, with the payers and understanding their needs and yours into that kind of overall contract kind of negotiation process.
Yeah, and Rafiq, if I could add one point to that, actually, you touched on it. We are approaching this with the payers as an extension of their provider relations team,
Hmm.
right? So any one of our customers individually probably isn't necessarily hitting the mark on their radar. But
Hmm.
in the aggregate, we represent strong interests. And what I've heard from a lot of the payers is that provider relations is getting harder and harder for them to do because as their networks are growing, their provider relations teams aren't growing commensurate with that. So we are providing a service and value to the payers too, where we're coming to them saying, look, let us represent your interests as well to our customers. So let's really bring everyone to the table together, not use this adversarially, but use it as a means to build a multi-year program together. And we'll act as your outsourced almost provider relations team as well. So I think that has been really well received by the payers because they want to understand how we're using the transparency data as well. And so we're really helping to educate them on how we're thinking about leveraging this.
And so diving in, so one thing that I found really interesting from what you said is that so you took it from so your solution before around contracting was that Prosperity wasn't offering that service. You were outsourcing it to a third party, and then you decided to bring that capability in-house. What was that like? What walk me through like what are the challenges of like building out that contracting capability, and kind of what were those, what were the pain points that you were really experiencing that kind of made kind of the decision to, move on transparency data or build out kind of resources within kind of successful? Like what was that transition process like?
Yeah. Well, I think the main component was convincing our customers that this was something they needed to do and worth paying for as a service from us. And in order to do that, first we had to help them understand that the market is looking for more in-network providers and not necessarily going to continue to reward out-of-network rates.
Mm-hmm.
So I think we had to help them understand that. And then the next natural question is, okay, well, what's the benefit for me as a customer to do this? Are my rates going to go up? Am I
Mm-hmm.
at the right market position? So I think we had to do two things. One, we had to bring in the expertise and
Mm-hmm.
we had to identify talent that had the experience in working with payers and providers and negotiating these. So we found that talent, we've brought it on. And naturally, the next component is, well, what are we going to use to inform our conversations? How do we help inform our customers where they're at today and where they need to be? And how do we bring, the way I always talk about it as an aside is I remodeled my home.
Mm-hmm.
And when I remodeled my house, I'm doing it one time. And meanwhile, I'm dealing with people that do this thousands of times and they have a lot of information at their disposal. And I'm doing this for the first time. So, how do I arm myself to have those conversations and even the odds in this kind of asymmetric conversation? And that's the same thing we're trying to do here. We're coming to the table. These providers may go once every 3 years. Meanwhile, the payers are doing this every day. So,
Mm-hmm.
how do we equalize that conversation with data? And that's what the payer transparency data does for us.
Very nice. And then were there, as you kind of started building this kind of capability out, kind of what were some of your early, outcomes? Was it something where you were like you identified the need for price transparency data early on? Did you just try to do it in a vacuum and use whatever data sources you had available? How was the early stage like on that front?
Yeah. I mean, initially, before we knew Serif existed, for example, we were trying to use our own internal data, but that wasn't great because we didn't have a lot. We'd have great concentration within certain customers, certain payers, less so elsewhere. And actually, the biggest challenge we were dealing with was we'd have a customer come and say, "Well, my buddy says he's getting this," or my somebody down the street says they're getting that, and we had no way to validate the veracity of those statements and be able to actually refute it or support it. And as we were looking at our data, we realized there were so many gaps in it, and we couldn't conceivably build this business in a scalable way without a solution to support that.
And so I think that's a good time maybe to talk about like maybe what the sort of your evaluation of the price transparency data and how we ended up starting to work together. So in terms of kind of identifying that need for better data kind of for this process, how did you look into the price transparency space? Kind of what was the team's awareness? What did your evaluation process look like?
Yeah, so we did a pretty deep diligence process and went out to speak to multiple companies that are out there that are offering price transparency data as a service. And I think and you could refute this statement, but I think as the way I view this, the core data set is out there, right? And actually I went to ChatGPT and said, "Hey, is this something we can do ourselves?"
Yeah.
And ChatGPT was like, "Nope, the data set is while it's being produced, it's not in a digestible format that you could do without any actual support." So I said, "Okay, great. So the raw data is there. There's people and companies out there taking that data, manipulating it, and making it digestible. Let's go find those companies." So we found three companies that offered this service, including yours. And I think the differentiator for us when it came to partnering with Seraph over the others was a couple things. One, your responsiveness, right? So anytime you're entering into a partnership, you want to work with genuine folks that
Hmm.
are willing to understand your problem set deeply and help you understand how they solve that problem.
Hmm.
and be honest, right?
Yeah.
Where are our gaps? Where are our abilities to support you? Where are we still young or in our maturity process and how we service this? And then I think the second component that was really valuable to us in the conversations with your team was the ability to be really flexible in the product integration strategy. So we have a crawl, walk, run strategy where we want to self-serve for our customers. We're using the data ourselves initially and then using it as a service or reporting aspect. But we ultimately want to integrate this into our existing product suite and then long term build products on top of this. And Serif said, great, that aligns perfectly with our vision and mission, and we're happy to support that. That was huge for us. That and that support of our product strategy and the willingness to kind of come along for the ride with us has been really important. And then I think the third part is we're learning how best to use this data.
Hmm.
We don't know what we don't know, and we're learning how to leverage the UI and navigate our experience with it. And your team has been great in supporting that. And we were looking for a team that understood we are going to evolve as how we
Hmm.
use. We don't know what the right way to use this. We don't know what the right way to have customer conversations. And we've had several instances with your team, both in the evaluation process and since we've started, where we're thought partners. We're sitting on the same side of the table, looking at the problem, saying, okay, how do we jointly solve this? And your team's taking notes, saying, there's some great use cases here that we could apply more broadly. And
Yeah.
we're, taking your experience and digesting it as well. So it's been a really great partnership. I think that's what we were looking for overall.
Yeah, no, I think that really hits on a lot of which is, this is great to hear because a lot of it is what we really try to emphasize as part of this process. Because I do think the one thing, even though we're a couple years in now of price transparency data being available, it's still what we say the really early innings of this. And a lot of our customers are all, we call them very, like anyone using this data is still on kind of the early innovative edge of whether you're a provider, whether you're an employer, whether you're a healthcare actuarial firm, kind of building on top of this data or using this data, you're still kind of very, very early to the game. And so in many of these cases for us, the focus is, okay, how do we kind of show where the data is really good and really useful for insights, but also show where there is still a gap in the data. And I think second is really like for us is a focus on kind of the improvement of data quality. And this is where in the behavioral health space, I think partners like yourself are really, really valuable is that we've been able to invest a lot through kind of your feedback and others' feedback around, what is working, what's not working, to really be able to be targeted and identify, what is accurate in this data amongst, in the case around SUD and addiction rates, when there might be one way that Aetna publishes it and another way that United publishes it or Optum publishes it versus, a Blue. So in that case, it helps us just improve the product as well. And I think that's where kind of these partnerships are really, really valuable and allows us to double down on kind of areas and specialties like yours.
Yeah, and Rafiq, if I could add, you had every right to sell this as a software as a service and just say, here you go. We're done. We sold it. You have access to it. We'll push updates. And I think what really cemented it is that you didn't. And some of the other companies we evaluated, that was kind of the approach.
Hmm.
And certainly that works, right? But while we're building our internal capabilities, we really needed someone who was willing to not just treat this as software as a service,
Yeah.
but partner on the development. So I think what you said, really it has permeated throughout your organization, and I can see that with your team. So grateful for
Yeah,
that.
no, we really appreciate it. I think like part of our excitement is that we actually think, as AI applications become kind of more and more the norm, we expect, I think price transparency and being able to get down to providers and patients in terms of what the actual cost is for kind of care in general. We think like this needs to be a foundational element of anything in the healthcare kind of ecosystem and space. If you're building, whether it's for providers, whether it's for payers, whether it's for patients, and trying to make that data as good as possible and push that forward with learnings from our customers is really, really important. So for us, I think the way the crawl, walk, run that you're describing kind of within Prosperity is exactly the same way we think about kind of our product and where we think it should go for price transparency data at large, is that we're in this crawl phase of early adopters and innovators using this data. The walk phase is, broader integration, just like as in your product more broadly, broader integration so that cost is there, people can see it. And then ultimately, it's just sort of a natural expectation of when people go see their providers that, everyone knows exactly how much they should get paid and when, and that it's a fair, it works out as a fair price that can ultimately, help us control some of the, unpredictability and costs that we experience today in American healthcare.
Absolutely.
Yeah. And so I wanted to jump a little bit towards kind of now that you have the price transparency data, how does kind of having clean, reliable price transparency data, change what's possible for Prosperity? And what are some like early wins or aha moments that you've experienced kind of since you've gone down this path?
Yeah, so I think first and foremost, it allows us to look at our payer relations as a service differently. And the first thing we've really been using the data to do is help our existing customers understand in truth where they are today, right? And there's a lot of emotion in our space, and especially in the treatment space for SUD and addiction treatment. A lot of our customers have come up through the recovery space, and so they're very passionate about the care that they're delivering. And as there's been reimbursement pressure, they're very passionate about making sure they're getting paid appropriately. And step one has been really managing expectations with our customers around where they're at today and where we think they can get in the next couple of years. So that's been a huge win because, historically it's been a little adversarial around, okay, you're my revenue cycle management company. How are you making sure I'm maximizing my potential reimbursement? And in some cases you're already at the market leader. You're setting the benchmark. And in other cases it's like, okay, you're under a little bit what the market is, but we can get you there. So I think that's been one early win for us, is just managing customer expectations. The second is it's starting to inform some of our conversations with the payers. We're going to the payers saying, hey, this is what we want to do. Here's how we're going to leverage the data. And I think it's taken some of the fear of being in a contentious conversation, because I have had some payers say, look, we've had former payer executives come to us saying, I have this payer transparency data now, and they're trying to use it, like a spear. And we're saying, no, 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 we want to use this more in a partnership. And I think they really appreciate that. So our customers are, I had one of our customers right when we first signed with Serif say, hey, I want to see this. Like, get me on a
Yeah.
Zoom. We got on a Zoom together and we don't
Yeah.
even know how we're navigating the UI UX, but he was so excited to see the data that we were, navigating it together. And so I think that's the reaction we've gotten, is a genuine excitement that there's access to this, and now the ability to plan how we're going to navigate the next 3 years together with the payer partnerships that we have. So
Oh,
that's been
very,
a great early win for us.
very interesting. And I can definitely sense a lot of the excitement from kind of your provider customers that this data is available, and kind of getting that sense of how they might be able to transform that relationship with the payer. How have like can you give me a little bit of some color on how did some of those early payer conversations go, kind of when you brought some of this price transparency data into the fold?
Yeah, the earliest one that sticks in my mind is we had a customer in Florida who had been, pretty much certain that they were getting paid less than their peers, and hadn't seen a rate increase for 5 years. Predominantly probably because they didn't even know how to navigate that. So when we had that first conversation with one of their payers, it was exactly what you would expect. Okay, we get it. They're underwater. However, we can't make this up tomorrow.
Hmm.
So how do we do that together? And so being able to have the data to be able to say, here's where we're at, here's what the benchmark is. The payer agree that in fact that is the benchmark, and not refute that statement, was critical too, right? It's a validating experience to know, oh, the data we have is correct. That's great. So, then it focuses less on whether we're right or wrong on what the rates are, and more about, okay, what can we do to get this provider to the right spot? And the payer told me, okay, here's how we're going to do it. Here's the right path. And at the end, thanked me for the fact that we approached this in the way that we did, because he had had a lot of experiences with folks that were either shooting from the hip
Hmm.
or not trying to do it in a thoughtful way, recognizing where the payer is coming from as well. Because they don't want to underpay folks relative to everyone else, but they're also figuring out what this transparency data means for them and their business. And so they need good partners in that process. And
Yeah.
that's what we're trying to be.
And are you seeing kind of an increased emphasis on payers, given, you've seen this shift from out of network to in network? Kind of, have you seen that? Have you seen payers even like proactively reaching out to you and your providers in terms of bringing them into the networks, kind of with a lot of the laws that have come into place since COVID around mental health parity and access?
Yeah, I've seen a lot of that. We've also seen a lot of, call it that, I'll call that the carrot. Hey,
Hmm.
you serve a lot of our members. We'd like
Hmm.
to have you in network. Seen the opposite too, which is some of our providers try to go in network and the payer say, sorry, we're full.
Mm.
And what we're advising our customers is don't be late to the game. Work with us,
Hmm.
leverage the data that we have, leverage your quality programs, get to the payers that are critical to your mission now, because you don't want to be last in line. Those networks are going to close, and then we're going to see exactly what's happened in, general medicine, which is they're not going to refer folks to out of network unless it's an exception. And that's where this market's going, and we want to help our customers get there first.
Yeah, no, I think that's really exciting. And so that I think helps us kind of look forward to, we're in this like if as you said, the crawl, walk, run. So we're in kind of stage one of prosperity, kind of building out this capability, kind of our partnership, working with the price transparency data. Kind of where are you thinking about kind of where this could go next? Like what does this look like kind of as you scale this across prosperity's operations broadly?
Yeah, so I think first and foremost is how do we productize this in our payer relations team? And how do we make sure that this is something that we can repeat across our customer base and with our new customers that are entering our services? And then it comes to that run, which is how do we really turn this into a data product that informs and leveraging other data sources, right? So how do we take the revenue cycle management data that we're getting today? How do we look at some of the quality data that our customers are generating in partnership with, outcomes monitoring firms or their own quality programs that they're developing, and then take that all together and use it to be a little bit more predictive. And then eventually, I know everyone says this, but eventually look at where risk-based arrangements can be
Hmm.
had. Because if you don't have this data, if you don't have the quality data, and you can't combine it all together with the claims data that we generate, it's
Hmm.
really hard to be in the forefront of a risk-based arrangement with the payers. And I do think that we have a strong opportunity to do that. And I think that could create a differentiator for us where, if we had a guarantee, a 90-day guarantee, no readmission guarantee, or something to that nature in our space that we could really back with data, that would really change the game for our provider customers and help payers see value in what we're doing together. So I think that's where we think we can get, and I know the challenge for everybody on value-based arrangements or risk-based arrangements is the same, but
Yeah.
we're trying to lead from the front on that.
No, yeah, I think that's definitely exciting to hear because I think a lot of the goal has really like how do we get to kind of value-based arrangements? And so kind of being able to use the price transparency data to kind of create that consistent baseline, I think kind of ends up hopefully being that springboard towards value that kind of we're looking for. And I think, across, whether you're provider or payer, that's kind of that win-win arrangement that everyone wants to see. So I think that just to so hopefully play a part in helping you get there is pretty exciting. Um, Kind of one of the last questions I wanted to have, kind of beyond kind of what Prosperity is looking forward to, kind of over the next 6 to 12 months, is what advice do you have out there to other behavioral health organizations? How do you think people should be, thinking about this process moving forward?
Yeah, and specifically around how to leverage payer transparency data or just in general.
Yeah, I would say both, like, yeah, leveraging payer transparency data in general, and then also, some of the strategy pieces that you have in terms of just that kind of creating that productive payer relationship.
Yeah. Well, I think a couple of things. One, when I was in my own personal entrepreneurial journey, I had an advisor tell me once in healthcare, you don't measure time in days and weeks, you measure time in quarters, years, and decades. So I think having a long vision is really important in the space that we serve in healthcare. If we were in a B2C space or maybe even in a different industry serving small and medium-sized businesses, we could have a shorter time frame, but we have to think long term and that has to inform your strategy, right? And I think that's first and foremost. Think about 5 to 10 years from now, not just next year or 2 years from now because you have to think like that. That's just the way this industry works. And,
Hmm.
for instance, we've been talking about value-based care since I've been in the space for 15
Yeah.
years, and I'm sure long before I was in the space. So I think that's one. And I think when it comes to the payer transparency data, I think it's really important to look at it as a win-win-win. So for in our case, as the service provider, it's a win for us. For our providers, it's a potential win, and for the payers. And I think that's the key point
Hmm.
in this is that you cannot treat this if you treat this like a gotcha with the payers, it's not going to set you up for success. You have to understand their perspective in this process as well. And when you combine that with that 10-year vision, I think that gets you to success because now we're looking at a 3 to 5 to 10 year journey with the payers and with our providers. And that really helps reduce the anxiety in the conversations together. So I think those two things are really important in the way I would think about this. You're not going to make up an under market rate overnight. Conversely, if you need to get in network, you got to think about what that means 3 years from
Hmm.
now, 5 years from now.
Yeah, no, I think that part really resonates because I think for part of even just the Serif journey of working on price transparency data, a lot of what we really emphasize as a company is that there's this trust gap that exists in healthcare that no one trusts anyone else. And that if we can really just focus on making this data better, making people see kind of, what exactly is there as the quality continues to improve, then you have this foundation, at least one piece of that foundation you can start to use to rebuild some of that trust across. And I think I love the way that you put it as the win-win-win, kind of for you as a service provider, the provider, the care provider, as well as the payer. And if we're able to kind of use this data in that way as a way to build trust, I think that's where we can hopefully see it succeed and get to sort of some of that long-term vision of how do we get to maybe truer value-based care or ways where there is fair, easy to understand pricing in the healthcare ecosystem.
Amen. Trust is the word. I agree, Rafiq.
Yeah, trust is definitely the word. So, Brett, this has been really, really great. Really appreciate you taking out the time out of your schedule to share a little bit more about Prosperity's story and kind of going through in some of the day-to-day, the challenges and opportunities ahead. And, thank you also for being such a great partner. We're looking forward to kind of all the potential kind of amazing things we can continue to build together. And for anyone listening who wants to learn more about what we discussed today, you can reach out to me or Brett, and you can also find us at the Serif Health team at serifhealth.com. And thanks again, Brett. And we'll be talking soon, I'm sure. So.
Yeah. Thanks for having me, Rafiq. I really appreciate it. It was fun.